So in the area of women's health care, while the media has failed to cover it and the numbers are less than the horrific abortion numbers, the top story in women's health care in this federal election 2020 is that the state of Minnesota is killing women in the federal breast cancer program to get the money, federal and matching state dollars for other purposes. So this has touched my life and that of our family since 2013 and still today. Minnesota needs to be turned around immediately and step away from stealing the cancer treatment funds dedicated by Congress to begin treating these low-income women diagnosed with breast cancer in the U.S. Senate program called in Minnesota the Medical Assistance for Breast and Cervical Cancer, or MABC. Under a bizarre interpretation by Keith Ellison, the man unfortunately elected the state's attorney general, women are aged out of their cancer treatment in clear violation of the Age Act, which forbids any denial or exclusion on the basis of age. And it violates the U.S. Constitution, and the money is taken from them and applied to younger patients, to their medical providers, leaving women in treatment uninsured by the program, and women die. Women are dying in Minnesota today and in other states because of a medical scandal my opponent, Tina Smith, has been involved in ever since she was in the governor's office of Mark Dayton. And it's one of the issues she's gone to Washington to pursue, to stop the life-saving women's cancer program from functioning. So a bizarre interpretation by the state relies on a 1982 case using the initial age criteria for the program, which excludes women who are 65 or older. And it reaches a conclusion that if a woman is diagnosed with the cancer while she is 64 and begins it, it ends when she turns 65. And Medicare will not cover these benefits. And I would, one, extend that initial Medicaid coverage under the categorical Medicaid program to age 69, which is the upper end of the so-called sweet spot for women getting breast cancer. It goes from 62 to 69, a lot of people. So I would work in the Senate to clarify, also in view of the recent case at the Supreme Court, a sense of the Senate that this interpretation must be paid attention to by the courts because it's at odds with, it violates the federal law passed in 2000, which was intended to completely treat the woman, and then the coverage would end. It's in the limitations period itself. Now, it was not, the law was passed in 2000. It was not part of Obamacare. It's a wonderful bipartisan women senators in action. Our senior women have virtually no supporters as this vengeful, silent killer takes these truly wonderful women abandoned to face the onset of cancer alone and the continuation of cancer alone. This is truly throwing Granny off the cliff. Now, secondly, the Supreme Court